Hello, dear friends. I'm Dr. Manjunath. Today, we are going to look at the BATURA study, which changed the GINA guidelines management, and it is going to have impact for a long time to come. See, this is a study which was published in NEJM in 2025. That is, as needed albuterol budesonide in mild asthma and implications for the clinical practice in the GINA guidelines. This, along with the Sigma and Mandala study, forms one of the most important studies which changed or rather influenced GINA guidelines to a large extent. Mild asthma accounts to about 50 to 70% of all the cases. But the fact is, nearly 30% of all severe exacerbations and asthma related deaths occur in this category, that is, the mild cases of asthma. The problem is because majority of the patients, majority of the doctors still rely on the historical practice, that is SABA alone treatment. We underestimate the power of SABA. It is a very powerful tool. It is a very powerful bronchodilator, causes instant relief for those patients suffering from symptoms. But the fact remains that the inflammation inside the lungs continue to happen, continue to trouble the patient no matter what. This disconnect is exactly why GINA abandoned the SABA alone treatment, and GINA recognized that every episode of symptom worsening represents not just a bronchoconstriction but an escalating airway inflammation. And therefore, anti-inflammatory treatment should accompany every symptom relief. Though the standard of care in many countries is ICS formoterol, that is inhaled corticosteroids with a long-acting beta agonist, is a very important standard of care in many of the countries, but the availability of this fixed drug combination still is very limited in many countries, and patients continue to take SABA alone as a treatment in many countries, and has resulted in this mild asthma patients resulting in severe complications and ending up in emergencies and deaths. BATURA was a 3B randomized double-blind event-driven superiority trial conducted entirely virtually across the United States. This itself is noteworthy because it represents one of the most largest decentralized asthma trials ever performed. And the investigators specifically enrolled children aged 12 and above in uncontrolled mild asthma, that is, who are on SABA alone or SABA plus low dose inhaled corticosteroids or leukotriene receptor antagonistic therapy. So these are the patients who were enrolled into. Despite that, many of those patients who are on this treatment were uncontrolled, and these were enrolled. 2,516 patients underwent randomization. The group 1 was albuterol budesonide at a combination of 180 mics of albuterol plus 160 mics of budesonide. And group 2, as needed, albuterol alone, that is 180 mics. And participants continued their usual maintenance therapy when applicable and were followed up to 52 weeks. The primary endpoint was first severe exacerbation of asthma. That was the question, and that was the answer what they were seeking. What is an important fact for us to note is nearly 75% of all these patients were on SABA alone treatment, and the average age of the patients were about 43 years. And almost 89% of patients had experienced no severe exacerbations in the previous year, highlighting that this was not a high-risk severe asthma population. BATURA study was stopped in between, or rather trials ended much earlier, because this was a practice-changing study. At a pre-specified interim analysis, the Data Safety Monitoring Committee recommended stopping the trial early because efficiency had already been clearly demonstrated. Let's look at the numbers. Severe exacerbation occurred in about 5.1% of patients receiving budesonide salbutamol combination and nearly 9.1% receiving salbutamol alone. That means the hazard ratio was about 0.53. That means 47% reduction in the severe exacerbation risk. The intention to treat analysis showed almost identical findings, that is 5.3 versus 9.4%, and the hazard ratio was about 0.54. And again, approximately a 46% in the reduction of the severe exacerbations. And the annualized exacerbation rate fell from 0.32 to 0.15, that is a 53% reduction. And even more impressive was the reduction in the systemic corticosteroid exposure. The annual prednisolone equivalent exposure decreased from 61.9 milligram to 23.2 milligram. That is a 62.5% reduction in the oral steroid burden. For clinicians concerned about the cumulative steroid toxicity, this finding is tremendously important. And let us look at the safety findings, what this study revealed. Overall, adverse effects were nearly identical, and 42.2% in the combination group versus 43.5% in the salbutamol group alone. And the local steroid related side effects occurred in less than 2% of patients, and serious adverse effects were rare and they were comparable between the groups. Thus, BATURA achieved a substantial reduction in exacerbations without introducing meaningful safety concern. So let us see how this BATURA fit into the existing evidence. See, this was not the only study which was done. Sigma trials demonstrated superiority of ICS formoterol over SABA alone treatment. And the Mandala trial showed that salbutamol budesonide reduced exacerbations in moderate to severe asthma. And this BATURA extends these findings specifically into the mild asthma populations. And what makes this study even more important is nearly 75% of those patients who were enrolled were SABA alone treatment. So, and that is where this study becomes very important in our day to day practice. Let us see the GINA impact from the BATURA trial. This probably is the most important section of this study. The BATURA study was designed because GINA had already moved away from the SABA alone treatment. The authors explicitly state that concerns about severe exacerbations, even in mild asthma, led GINA to stop recommending monotherapy of SABA alone and instead recommending ICS containing reliever across all treatment steps. BATURA therefore serves as a powerful validation of the GINA philosophy. GINA recommendation was based largely on the evidence of the ICS formoterol before this study. Now, with the robust evidence what this study gave us, salbutamol based reliever strategy can dramatically reduce exacerbations when paired with inhaled corticosteroids. The implications of this study are very profound. It reinforces the concept that every reliever should always be coupled with an inhaled corticosteroid. It also provides evidence based alternative to SABA alone treatment, and it encourages broader adoption of anti-inflammatory reliever therapy in countries where ICS formoterol combination may not be easily available. The major drawback of this study is the mean age of the patients selected is about 43 years, and we are forced to translate what is available for that age group for even the adolescent age group. That is probably the only drawback what this study has. With this, we have some very important take home messages, and that is mild asthma is not benign. SABA only treatment leaves the inflammations continue to happen inside the lung. And BATURA showed 47% reduction in the severe exacerbation and 63% reduction in the systemic steroid exposure with as needed salbutamol budesonide combination. This trial also provides a compelling evidence supporting GINA move towards anti-inflammatory reliever therapy for all asthma severities. Thank you for patient listening. I would request all of you to hit that subscribe button and comment and ask questions wherever it is feasible. So this keeps us motivated to keep making videos which are very meaningful for all the doctors and the patients of the fraternity. Bye bye.